Hello, my name is Heather Cox from the Sand Hills Community College Nursing Department, and today I'm going to talk to you about how to put on and take off personal protective equipment. The first thing we're going to go through is how to put it on, and then we'll stop and then go through how to take it off appropriately. First thing you need to do is always review your patient's medical record, and you need to review what kind of precautions that they have and what kind of personal protective is required. Whether it be the gown, the gloves, the mask, all the pieces that are required, and you always need to make sure what kind of precautions your patient has going on so that when you go in the room that you're ready. You always need to get all your equipment ready before you go in so that you enter the room prepared. So the first thing I'm going to do is take a look at the equipment, and today I'm going to show you how to put on the gown and how to put on the mask and the gloves, so if the full amount of equipment is required, you're prepared. Before you start, you always want to come over and you want to either foam in and out, or you want to clean your hands in some manner. You want to make sure that you brought the appropriate equipment with you and that you have everything that you need and that you're thinking about all of the things that you're going to need to do before you go into the room. Okay, so the first thing I'm going to start with is your gown. Once you pick your gown up, you want to make sure that you examine it and make sure that it's clean and dry, and make sure that you have the ties on the outer side where you can get to it. You're going to go ahead and slide your arms in. Once you get the arms in, you want to go ahead and tie it at the neck. This may be a little difficult, so if you find that your hair is in the way, you might would have wanted to go ahead and get it up and out of the way. And most of the time when you guys are wearing your uniform, it's going to be at the collar or up off the collar. When you go to do the back, you want to make sure you pull it completely around and have it completely sealed. And you can either tie it in the back, or if your strings are long enough and you feel more comfortable, you can tie it in the front. My strings are not long enough on this gown for me to tie it in the front, thus I'm going to tie it in the back today. But like I said, make sure that you have, the back pulled together completely so that the gown doesn't come open on you when you're doing this. So now I've got the gown on, I've got the neck tied, I've got the back tied, and everything is on and ready. The next thing I'm going to do is go ahead and get my mask. If you'll notice, this mask actually has a shield. So it should be used as if it was the mask with goggles, because this is considered protective eyewear. So what I'm going to go ahead and do is put this on. You make sure you put it behind your ears, and then you pull it over your mouth, and you actually push it together so that it protects your nose. Okay, now I'm going to get my appropriate gloves out of the box or container that they're secured in. Once I get the gloves out, I want to go ahead and put them on. And as I'm putting the gloves on, I want to make sure that I pull them over the sleeves of the gown to make sure they are tucked in well so that I don't have any leakage or drainage over the top of it. With these gloves, you can certainly pick and adjust and make sure that the gown is tucked in appropriately and so that you're adequately protected and covered. And now we have on a full complement of personal protective equipment, including the gown, the gloves, and the mask with the face shield. Okay? Now that we've got our personal protective equipment on, I would make sure that once I entered the patient's room, I would need to identify the patient and let them know any procedures or anything that I was going to do before I got started. Certainly before I entered the room with all of this personal protective gear on, I would want to educate the patient and the family about the reason for me wearing this personal protective equipment, answer any questions that they had. Now that we have put on the equipment, I'm going to go through how to take it off. If I had tied the gown in the front, I would untie the gown first before I started because the front of the gown is considered contaminated. But since my gown is tied in the back, I'm not going to do that at this point. Thus, the first thing I'm going to do is take off my gloves. So the first thing I'm going to do is take my first glove, and I'm going to grab in the middle of the glove and pull the glove off. And then with the second hand, I'm going to come under so that I don't contaminate this hand, ramp the gloves up, and then go ahead and dispose of those in the proper receptacle. Alright, so I've taken off my gloves. So the next thing we're going to do, since I have a mask that is combined with a face shield, or this would be considered a mask with goggles, I need to take those pieces off next. So you're going to start up here at the ears. You're going to move only with the earpieces. You're going to let this fall into the trash receptacle. Since I have my gown tied at the back, I'm now going to come back here, and this is the reason that I have completely tied the gown behind my back and folded it all together. I'm now going to come and untie the gown. Once I have it untied, I'm going to come up, and I'm going to come to my shoulder, and I'm going to pull it down from the shoulder once I untie the neck. I'm going to pull it down from the shoulder and roll the gown down and roll it in on itself. Up and roll it down and in on itself. And then I'm going to fold the gown up. And then I'm going to properly dispose of it in the waste receptacle. Now, if I had had a plain mask without a face shield or goggles, I would remove the gown first, and then I would lastly take off my mask. Thank you very much. Okay, continuing on with the personal protective equipment. In the first part, I showed you the yellow gown, which comes in your kit, but just so that you're aware, there are different gowns at different agencies, and you could see a gown like this. So once you've gathered your equipment and everything, if your gown is in fact this tight, which is the blue plastic, then you want to do the same thing as you did with the other one. When you open it up, you want to inspect it and make sure that everything is clean, dry, and intact, you know, and everything is there. There is a hole for your head, so you want to go ahead and put the head in there. And then you can slide your arms in, and if you'll note, they have open holes for the thumbs. You want to stick your thumbs through here. There is no neck tie because there's a hole already for the head. So when you're going through and doing this, you're also not going to be able to pull the gown completely behind you unless you have a large enough gown that allows for that. But you can either tie the gown in the back, or if your strings are long enough, you can tie in the front. It's up to you whichever one you do. I'm going to have to tie in the back to make sure that I have adequate coverage for the tie. So I'm going to go ahead and do that. And again, it's its own challenge. Okay, so now that I have the gown on and my thumbs are in the thumb holes, this would be the point where I would go ahead and put my face mask or my face mask with shield on. So I'm going to go ahead and slip this on behind my ears. Make sure I go ahead and fit it around my nose, and then I'm going to move to put my gloves on. And then get your gloves, and you simply slip the gloves over the top of the plastic gown, and the thumb holes actually help hold the gown down inside the glove. And again, the second glove. And my thumb is still in the thumb hole here in the gown. Of course, it helps if you have your glove turned the right way. And then just make sure you've got the gown tucked down inside your gloves. And that is it. Hello, my name is Heather Cox from the Sandhills Community College Nursing Department. And in this video, we're going to be discussing how to set up a sterile field and how to move around in a sterile field. So the first thing you always want to start off with is your equipment. Before you come and set your equipment down on the table, you want to make sure that you have a clean, dry surface, because if it's wet, it could end up contaminating your packages. The next thing you'd want to do is any supplies that you need, you'd want to gather first, and make sure that you always examine them and make sure that they are clean, dry, and intact, and make sure that they are within the expiration. So what I'm going to do today is I'm going to set up a sterile field and add something to the sterile field. So before I begin, I have examined my surface, I've examined my packages. I'm also going to go ahead and make sure that I get anything that's in my way out of the way, including long sleeves, anything that would end up contaminating the sterile field. So I'm just going to roll up here for just a minute. Once I'm done with this, I want to go ahead and make sure that I performed hand hygiene. So you need to either foam, wash your hands, whatever it is that you're doing for your agency policy. And once I get complete with that, I'm going to go ahead and set up my field. I need to make sure that I have a large enough field to be able to accommodate what I'm doing here on the table. And certainly I would need to set up the field at the bedside for wherever I'm performing the procedure. So I'm going to go ahead and move things around and out of my way. I've already examined my package and made sure that it's clean, dry, and intact and within date. When I open it up, I'm going to open it back, making sure that I do not open anything that's inside. And I'm actually going to set it down here. Now, as I open up sterile items, I need to make sure that I would not be talking over them. The reason I'm talking, obviously, is to film the video. But if you talk over them, you could spread droplets and germs, and then you could contaminate your field. You also do not want to reach over the field. So I'm going to come in and grab from the corner. Once I grab from the corner, I'm going to let it fall naturally. If it does not open naturally on its own, I will grab the other edge and making sure to examine it. So this is my sterile field. If you will look at it, you have one side that's a shiny side and one side that is not. And normally I wouldn't be turning this around and manipulating it, but I want to show you the difference. The shiny side always goes down on the surface because that is the waterproof side. And also on your sterile field, once you have it established, you have a 1-inch margin from all of the edges. Beyond the 1 inch outside, it's considered contaminated. Inside the 1 inch, it is considered sterile. So as I am opening up, when I'm ready to add something to the sterile field, I want to make sure I am not over the top of my sterile field. I need to open the package, back away from it. I'm going to peel down without touching the object or talking over it. I'm going to come from 4 to 6 inches above my sterile field. I'm going to drop the object without touching it and then very quickly move back from my field with the package. So I would have already cleaned my hands and established this sterile field with this container on the sterile field. I have added it sterilely. So now we're going to discuss how to add liquids to a sterile field. The first thing I need to do is anytime I maneuver in the sterile field, I'm reaching around it. I'm not reaching over it. I wouldn't be talking over it. I'm going to go ahead and inspect whatever liquid it is that I'm going to be adding and make sure that it's the appropriate liquid. I need to also make sure that it's within the expiration date and that I can read the label appropriately. Once I've established all of that, I'm going to go ahead and open up the liquid. If it is sealed already, then I know that it's brand new. I need to go ahead and take the cap off. And without touching the cap, I'm also sitting the cap upside down so that I don't contaminate it. The label goes in my hand, and I'm going to pour off the very top, which is what we call lipping fluids, without touching the container to anything. The label is in my hand, so I do not spill any liquid on the label. I'm going to come above my field, and I'm going to add from 4 to 6 inch height and pour the liquid into the container for the amount that I have and that I need. Once I have done that, I'm going to move very quickly back away. I'm going to come and grab the cap. I'm going to replace the cap. And I now need to date, time, and initial this, and depending on agency policy, depends on how long this fluid is good and able to be reused. Then I would keep it at the patient's bedside. Hello, my name is Heather Cox from the Sand Hills Community College Nursing Department. In this video, I'm going to be showing you how to put on and take off sterile gloves. The first thing you always need to do is make sure that you've got the appropriate size sterile glove for you. Make sure that you've examined the package and that it's clean, dry, and intact, and that the expiration date is within the range that you need. Another thing you'd want to do is make sure that you remove anything that will get in your way in working with the sterile glove. So if you have long sleeves, you'd want to make sure that you get those up out of the way so that they're not interfering with the gloves and the sterility of the glove or the procedure that you're going to be doing, or certainly take the jacket off if it gets in the way. Once I get these up out of the way, any jewelry that would interfere with anything, such as the watch, you can either remove it or make sure that it's up higher than the level of your sterile glove. I'm then going to come over and perform hand hygiene by foaming in. Once I make sure that my hands are taken care of, I've already examined the package. This functions as a sterile field, so I need to make sure that the surface is clean and dry. So I'm going to make sure that the package still is clean, dry, and intact. Make sure I've got the appropriate size. And if you look, you can plainly see that the fingers are here and the cuffs are here. So when you set this up, you want the fingers facing out and the cuff facing towards you. I'm going to go ahead and open up the package, fold the top back. I'm going to fold the bottom back. Then I'm going to come under the edges to make sure I do not contaminate the sterile gloves inside. Once I fold this back, again, this is just as if I have a sterile field, so I have a 1-inch margin around, following the same rules as sterile technique with a sterile field. When I come to put my first glove on, I'm going to grab the cuff inside because that is where my hand goes. If I touch the outside of the glove, I've contaminated it. Once I pick the glove up, I'm going to step back from my field, keeping my fingers down. I'm going to come in with my hand, making sure that the other hand only stays on the inside of the cuff. I keep my hand up, and I now have the first glove on. So this hand is now considered sterile. I'm going to put my fingers together and come underneath my second glove, and I'm now under the inside of the cuff because this whole glove is now considered sterile, but I want my fingers under the cuff to protect them from the non-sterile hand once I put the glove on. I'm now going to take a step back so that I do not contaminate my gloves with the table. My non-sterile hand goes inside, Meanwhile, the sterile hand is still inside the cuff to protect the sterility. I pull the glove up, and I have my gloves on. Now, if I need to adjust, let's say if the fingers went in a double hole together or something like that, this would be the point when I would adjust them because both hands are considered sterile. If I needed to adjust the cuff, I could come down and adjust a little bit, but be very careful about doing much maneuvering down here below the palm of the hand because you're likely to contaminate your hands. Anytime I maneuver around when I have sterile gloves on, I need to make my hands above my waist. If you ever lower them down below your waist, then they are potentially considered contaminated. Thus, I need to make sure they're always above my waist, and my sterile field always needs to be waist height to make sure I'm maneuvering around appropriately. If I'm going to take the gloves off, now when I'm ready, I'm going to grab the other glove in the palm of my hand, and I pull it down and off. I'm now going to wrap it up in this hand, come under the cuff, pull this down and over. I'm going to dispose of them and any of the other objects in the appropriate trash receptacle. I'm now going to come over and I'm going to perform hand hygiene. Hello, my name is Heather Cox from the Sand Hills Community College Nursing Department, and this morning I'm going to talk to you about nasopharyngeal suctioning. The first thing I'm going to do is talk to you about the things you need to do outside of the room. So the first stuff I would need to do is review the patient's medical record and make sure what kind of history they have, respiratory-wise especially, since this would affect oxygenation. Make sure there aren't any contraindications to the suctioning, and verify the doctor's order for the suctioning. I'm also going to make sure that if I need personal protective equipment, and usually with this procedure I would advocate for you wearing it. I'm not going to wear it in the video for the sake of showing you the procedure. Before I'm ready to enter the room, I would need to make sure that I've gathered my equipment, and I think and be mindful about what I'm doing in the room so that I have all the supplies before I begin. I'm going to show you the supplies once I enter the room. Now that I am outside of the room, before you enter, you need to also think about a couple of things. Whenever you enter the room, you need to think about aid it. Acknowledge, introduce, duration, explanation, and thank you. Acknowledge, once I enter the room, I'm going to acknowledge the patient, call them by name. I'm going to introduce myself. I'm going to tell them an explanation of what I'm doing and giving them a duration for what they can expect me to be doing. Explain things, explain to them if they need me to stop, what they need to do to tell me that I need to stop. And when I'm done with the procedure, I need to thank the patient and ask them if there's anything else I need to do. There are also 4 other things that you need to do, which are considered the 4 P's. Pain, potty, position, and proximity. I need to make sure that the patient's not in pain before I start, and if I need to pre-medicate them before the procedure, I would need to do that about 30 minutes ahead of time. And at the end of the procedure, I need to make sure that the patient's not in pain. I also need to make sure that they don't need to go to the bathroom once I'm finished. I need to make sure that proximity, everything is within their reach. The bedside table has been returned, the call bell is within their reach. And I need to make sure that they're in an appropriate position that's comfortable for the patient. I'm now ready to enter the patient's room. I've verified the doctor's order, any equipment I needed. I'm going to have it at the bedside. I'm going to go ahead and foam in as I enter the patient's room. Now that I've entered the patient's room, I'm going to acknowledge him and introduce myself. Good morning, Mr. Smith. How are you doing this morning? He would be interacting with me back and forth and speaking to me. I'm going to introduce myself. My name is Heather. I'm going to be your nurse this morning. And I see in the doctor's orders that they've got ordered for you for some suctioning. And when I came in earlier with you, I think you indicated to me that you might need to be suctioned. Can you please tell me your name and date of birth? I'm going to come over to his armband, whichever arm that it's on, and I'm going to have him, please can you repeat your name and date of birth for me? I would make sure and look at the armband at the same time that he is speaking to me and make sure that what he tells me matches, and I have now identified my patient. I have acknowledged him, I have introduced myself, and I have identified my patient. Mr. Smith, I'm now going to go ahead and assess you and make sure that you need to be suctioned. Part of the assessment would include listening to his breath sounds. So I would need to make sure that I listened anteriorly, and I would have him sit up or turn to the side, whichever he was able to do, and I would listen to his breath sounds for crackles, wheezes, gurgles, any of those kind of things that are adventitious sounds. I'm also going to count his respiratory rate and note the depth and if he has any accessory muscle use. And then I can also listen to his work of breathing and listen for secretions. One of the primary reasons for suction is that your patient has secretions that are thick or tenacious. They're hard for them to clear. And he has indicated to me that he's having some issues with secretions and that he needs to be suctioned. And I've heard some adventitious sounds. And so I have assessed, and there is the need for suctioning. Another assessment parameter that I could do, I could be monitoring his pulse oximetry. And I would usually do that throughout the procedure to make sure if he is tolerating the suction or if he is not. The patient may or may not be on oxygen. Depending on the hospital policy, depends on whether or not you can put them on supplemental oxygen or whatever before you begin. And regarding the patient's oxygenation status, your patient may already be on oxygen as ordered, or they may not be. If they are not, depending on your hospital policy, they may have a policy for you to place them on it and potentially oxygenate the patient. Mr. Smith is currently on 2 liters of oxygen by nasal cannula, so we're going to leave this on him throughout the procedure. So I have gone in and I have explained the procedure to him. I've verified that he's on oxygen. I've verified the need for the suctioning and all that stuff, and he says he's not in any pain and he's ready for me to start the suctioning. So the next thing I need to do is go ahead and get his bed to an appropriate height. So I'm going to raise it up, and typically it's around waist height of the nurse. I need to make sure that he's in the proper position once I get the bed up, and that would be in semi-Fowler's for a conscious patient. If the patient is not conscious, you could potentially turn them to the side and be able to do your suctioning this way. So I'm going to go ahead and roll him up to at least semi-Fowler's position, and I need to make sure that he is in an appropriate position where I can reach him. Before I begin, I'm going to put the rail down. I'm not quite ready to begin yet, so I'm going to leave the rail up for just a minute. I'm going to switch over and begin talking to you about the equipment necessary for the suctioning. All right, and so equipment that is necessary, I am going to need a waterproof pad. So at this point, I'm going to go ahead and open this up, and I'm going to put this on Mr. Smith's chest. This will assist me with keeping him and his bedding clean and dry. I'm going to make sure that it's underneath the oxygen so that I can move the oxygen when it's time. I've got the other equipment here necessary for the suctioning. Once I'm completed with the whole suctioning process, I'm going to offer him mouth care at the end. So I also have supplies over here for mouth care once I'm completed. The primary thing that you're probably going to use for your equipment will be a suction cath and glove kit, and pretty much all your equipment comes in here except for your normal saline or whatever the policy says that you need to be using to clear your line. So as with any sterile kit that you're looking at, you need to make sure that it's clean, dry, and intact, and make sure it's within the date. If you'll notice on this package, it says that it's latex free. You need to make sure that your patient does not have any allergies to latex or anything that is in the package or any of the products that you're using during the procedure. And Mr. Smith has already confirmed with me that he has no allergies. This is latex free, so that's even better. Once I'm ready to set this up, I would open it up and I would move around in it in the same manner as I would for any sterile field. So I'm going to go ahead and get my surface up here. I'm going to pull the trash can up here close to me, so in case I need to use the trash can for anything. If I ever touch the trash can, I need to make sure that I foam in and out and clean my hands again because the trash can is considered contaminated. As I'm looking at this, I'm also examining the liquid and making sure that it is the appropriate liquid, that the expiration date is correct. If it has already been opened, as this one have, it should be dated, timed, and initialed, and it should be within the expiration date of the opening of it, usually within 24 hours depending on hospital policy. I'm now ready to begin setting up and performing the procedure. So what I'm going to do is go ahead and I'm going to let the rail down so that it does not get in my way when I'm ready to do my suctioning. I can go ahead and foam again to make sure that my hands are clean before I begin handling the packages and starting the procedure. Once my hands are dry, I need to make sure that I've established some manner with Mr. Smith for him to let me know that when I'm doing the suctioning that he needs to let me know if I need to stop. So if I need to stop, Mr. Smith, if you will just let me know. And he's able to speak and communicate with me. If he's not, I could establish that he could raise his hand, whatever it is that he needs to do. The last thing I need to do before I set up the rest of the equipment is I need to make sure I'm checking my suction. And over here you'll see that I have a suction control and I have a suction set. So when I'm coming through over here to do this, I need to make sure that I have on a clean glove. I need to come up and make sure and turn on the suction. When I turn on the suction, I'm going to turn it over to the regular or continuous setting, and I'm going to set it for an adult between 100 to 150 millimeters of mercury. You need to go back and review on your skills check sheets what it would be for an infant neonate